Buenas and Hafade, Imina 26 na Legislature in Guam is back in session. We are on second reading, and we are currently on Bill 111. Senator Shelton, you are recognized.
Siduous Masi, Madam Speaker, Buenas and Hafade, colleagues. I move to place Bill number 111-36 as amended by the Committee on Health, Land, Justice, and Culture in the third reading file, and I ask for the opportunity to discuss the measure.
Please proceed.
Siduous Masi, Madam Speaker. Bill 111 seeks to fill a gap in the law governing testing for HIV for perpetrators indicted with criminal sexual conduct at the request of a victim. Survivors of criminal sexual conduct experience trauma that no human being should have to endure. Perpetrators violate these individuals' bodies and forcefully strip away their autonomy. Bill 111 adds one more measure of protection for survivors of these heinous crimes. Madam Speaker, mandatory HIV testing programs permit victims of these heinous crimes to learn when their attackers test positive for HIV. Pre-conviction testing provides this information at the earliest possible opportunity. Victims of such crimes suffer extreme mental anguish, and to deny these individuals access to knowledge of possible exposure unnecessarily subjects them to additional pain and agony. And medical professionals have acknowledged that early diagnosis of HIV is a critical element to any type of treatment plan. Madam Speaker, there is compelling local data that urges this body to act. According to the FBI's Uniform Crime Report recently published by the University of Guam, our island has the second highest rate of sexual assault in the nation, and 75% of the criminal sexual conduct cases reported to the Guam Police Department involved victims who were minors in 2020. Data from the Division of HIV/AIDS Prevention at the Centers for Disease Control and Prevention in 2018 notes Guam's HIV rate of infection at 4.2 per 100,000 people. Data from the Office of Epidemiology and Research at the Department of Public Health and Social Services report provides an incidence rate for HIV, or the rate at which it occurs in Guam, at 0.5 times much higher than any other regional neighbors, such as the Commonwealth of the Northern Marianas, at only 1.9. This data is compelling enough for us to act, and I know tackling such challenges requires a real well-rounded effort on all fronts. Bill 111 offers to provide more protections for victims and more information for our community to stop the spread of such diseases. In addition, Bill 111 comes at the heels of our Community Outreach and Federal Programs Office's receipt of a grant from the Office of Violence Against Women at the U.S. Department of Justice. This grant allows Guam to train more nurses in forensic sexual assault exams under the Improving Criminal Justice Responses to Domestic Violence, Dating Violence, Sexual Assault, and Stalking program. A condition of this grant is that Guam must meet the requirements concerning HIV testing of defendants charged with criminal sexual conduct at the victim's request under 34 U.S.C. Section 10461D. And Madam Speaker, I know there may be some concerns regarding the potential infringement of the rights of the accused, especially on the grounds of equal protection and due process. But I want to inform this body that most states, 37, have laws that allow for pre-conviction testing. either at the request of the victim, court-ordered, or both. In approximately 11 states and territories, including Guam, testing is only done when the person is convicted. More states have in place legislation geared toward protecting the victim, even if the perpetrator has not been convicted. This is where Guam needs to be. As provided in Bill 111, where if the victim requests it, an alleged perpetrator must undergo court-ordered HIV testing. There is also extensive case law on the issue alone, and I want to specifically point out the special needs doctrine developed by the United States Supreme Court in 1989, where the court authorized the government to test individuals for illegal drug use without a warrant or any particularized suspicion. Since then, many lower courts have applied the special needs analysis to compulsory HIV testing, where the court must determine, 1, whether the blood testing scheme arises from a special need beyond the needs of ordinary law enforcement, and 2, if so, whether the intrusion of compulsory blood testing for HIV without probable or individualized suspicion that the virus will be found in the tested person's blood is justified by the need. The courts determined that this special need was met because the testing scheme was in place to protect the victim and regulate public health. And the defendant is not being tested in an attempt to obtain criminal evidence for the purpose of prosecution. Again, in this type of testing, the defendant is not being tested in an attempt to obtain criminal evidence for the purpose of prosecution, but to protect the victim and to regulate public health. The court then went on to balance the individual's interest in avoiding mandatory testing against the government's interest. The court determined that the government's interest was so compelling that it outweighed the individual's interest in avoiding the testing. Madam Speaker, I also like to point out to my colleagues the endorsement of the Federation of New York State Judges of mandatory HIV testing for sex offenders at the pre-trial stage in 1996, where they stated that the rights of victims and defendants could be balanced if the confidentiality of the test was assured, if the results could not be used as evidence against the accused, and if judges ordering a test were required to weigh the nature of the exposure and the medical and psychological benefit to the victim against the potential harm to the defendant. In our efforts to protect the rights of victims, I certainly want to ensure that the accused are afforded the privacy and due process to which they are entitled. With the Federation's endorsement in mind, I firmly believe that Bill 111, as amended, succeeds in balancing the rights of victims and defendants. For the benefit of our colleagues and the public, I'd like to go over the amendments to the bill made in committee that highlight our effort to balance the rights of all involved. And I want to thank you, Madam Speaker, and your committee staff for their work in ensuring that this measure addresses all concerns brought forth during the public hearing process. First, the bill was amended so that the administration and analysis of medical examinations and the furnishing of results under these provisions are subject to HIPAA confidentiality and privacy laws and regulations. This is to ensure that the rights of privacy of those tested are protected. Second, the bill was amended to include follow-up testing, which will also be subject to HIPAA confidentiality and privacy laws and regulations. Follow-up HIV testing is also a condition of the OVAW grant. Third, the bill was amended to specify that the testing be done only to determine and detect HIV infection and no other sexually transmitted disease. This is in line with the provisions of 34 U.S.C. Section 10461D, where federal funding through the OVAW grant is conditioned only upon testing for HIV. Fourth, the bill was amended to provide the alternative of court-authorized testing at a private clinic. This change was recommended by our Department of Public Health and Social Services, who stated that there are no identified supports to carry this out, the mission of testing alleged perpetrators, and that in such situations, testing can be done at a private clinic. Lastly, the bill was amended to make clear the need to establish probable cause prior to a court-ordered HIV test for defendants. With this change, the prosecutor, at the request of the victim, can petition for court-ordered HIV testing. In addressing such a petition, the court shall first find that there is probable cause that the alleged sexual contact or penetration poses a risk of HIV transmission. Madam Speaker, through these amendments, I believe that we have succeeded in ensuring the confidentiality of the tests and results, the inability to use these results as evidence against the defendant, and the opportunity for judges ordering a test to weigh the nature of the exposure and the medical and psychological benefit to the victim against the potential harm to the defendant through a probable cause hearing. Madam Speaker, I'd also like to note for the body that this version of the bill was vetted by our partners at the U.S. Department of Justice. I want to make clear that this measure was authored on the basis of conditions set forth under federal law, and such conditions are enforced in grants through the Department of Justice. And I implore my colleagues to consider in its evaluation of interests of victims, defendants, and our entire island as a whole, the large number of states that have implemented mandatory pre-conviction testing, the benefits to empowering victims with information, and the great interest for the island community to deter the spread of disease. Because if we want our justice system to be truly effective, these examinations on the perpetrator must be as close to the criminal act as possible. And Bill 111 benefits our community on two fronts. It empowers survivors of these heinous crimes with knowledge to make critical healthcare decisions, and it strengthens our testing system through the Office on Violence Against Women to train additional nurses to conduct forensic examinations. Madam Speaker, I want to thank you for the opportunity to speak on this bill, and I look forward to any discussions today. Sidus Masi.
Sidus Masi, Senator. On Bill 111, is there anyone who'd like to be recognized? On Bill 111. If not, then Senator Nelson, you are recognized.
Sidus Masi, Madam Speaker. Madam Speaker, I rise in support of Bill 111 and thank the main sponsor for adopting what is really a model testing scheme across the United States. As the sponsor has already mentioned, there are clear benefits to the kind of victim-centered approach reflected in this bill. An academic journal published by the University of Buffalo School of Law on HIV testing for convicted or accused sex offenders discussed some of these, noting that knowledge of the accused offender's HIV status will allow the victim to make an informed decision regarding the need for precautionary measures to protect those persons closest to her. Such knowledge will also allow her to weigh the costs and benefits of continuing drug therapy to prevent contraction of HIV. These statutes are not meant to punish or stigmatize persons with an HIV-positive status. Rather, the statutes are aimed at limiting the harm that has been perpetrated upon the victim of a sexual offense and controlling the spread of HIV. And so this kind of provision extends beyond the victim, providing a public health benefit by preventing the spread of the virus to the victim's loved ones and other members of the community. This is particularly important given that HIV can be passed from a pregnant mother to her baby. Thus, as the journal states, for a sexual assault victim who is either pregnant or thinking about becoming pregnant, the HIV status of her accused assailant has consequences not only for her and her partner, but also for her unborn child. Testing can also help reduce the psychological trauma associated with sexual assault. As my colleagues are aware, this harm is not limited to the trauma of the original assault, but also the fear of HIV infection, a fear which, if not adequately addressed, could potentially delay the healing process for the victim. Finally, as local service providers have testified, if this bill is not passed into law, Guam stands to lose a portion of our total ICJR grant award, a loss that would unduly impact our Rape Crisis Center and Healing Hearts. Despite this victim-centered approach, Madam Speaker, the sponsor also took great care to ensure that procedural safeguards are incorporated into our testing statute, including the threshold requirement of probable cause, the preservation of confidentiality, and the protection of the defendant's constitutional rights. Overall, this measure presents a more holistic response to Guam's victims. I thank the sponsor for this important policy, and I ask my colleagues to stand with Guam survivors in support of this measure. Sijus Masi, Madam Speaker.
Sijus Masi, Senator. On Bill 111, is there anyone else who'd like to be recognized on Bill 111? If not, then the sponsor may close on the bill.
Sijus Masi, Madam Speaker. Thank you very much to my colleagues for their support. And I ask for consideration of this bill to ensure that we're doing the best for our survivors and to stop the spread of disease in our community. Thank you very much, Madam Speaker.
Thank you. On the motion to place Bill 111-36 on the third reading file, is there any objection? Hearing and seeing no objection, motion carries. We are now on Bill 162. Senator Perez, you are recognized.
Thank you, Madam Speaker. I'm going to set aside this bill from this session. Thank you.
Oh.
Motion to set aside.
On that motion to set aside and to place it in the next session, is there any objection? Seeing no objection, motion carries. We're now on Bill 70-36 COR. Senator Blas, you are recognized.
Thank you, Madam Speaker. Motion to send the bill back to committee.
On the motion to send the bill back to the committee, is there, can you specify the committee that it was in, Senator, if you remember?
Committee on General Operations, Appropriations, and Housing.
On the motion to place the bill back, send the bill back to the committee, is there any objection? Seeing no objection, motion carries. We are now on Bill 130. This bill is supposed to be heard in the Committee of the Whole, so we would recess until 2 p.m. when we will reconvene in the Committee of the Whole for Bills 130, 121, and 153. We're now in recess till 2 p.m.